Okay. Hello and welcome to our TED Talk on Discrete Trial Training, or DTT. My name is Anna Castengay, and with me are Andrea Kramer, Heather Kim, and Amanda Jackart. We will be discussing how DTT, an intensive teaching strategy, is used in the field of applied behavior analysis and how it is useful in teaching skills. We will discuss how to implement DTT and provide a model. We will then discuss data collection and analysis, DTT's potential implementation in a school-wide plan, and tips when running discrete trials. To help depict the DTT process, we will be telling the story of Lucy, a little girl diagnosed with autism who cannot label or identify colors. Receptively identifying colors or pointing to something that is yellow when someone says yellow is the first step to teaching a child how to differentiate between colors. Amanda will now give us an overview of research regarding DTT and who or what DTT is appropriate for.
DTT has been proven useful in lessons such as color identification with children who have a diagnosis of autism spectrum disorders. DTT breaks skills down into simple components and creates teachable steps that will lead the learner to master and demonstrate the skills independently and fluidly. DTT is typically adult-driven, practiced at a table, and allows for many teaching opportunities in shorter amounts of time. This is beneficial because children with ASD do not learn as easily through peer observation alone. DTT creates a teaching environment where the child learns that they need to respond to a stimulus, they know what a correct response is, and prompting is provided to reduce or eliminate errors. For Lucy, she will be learning to identify colors in a field. DTT will allow her to rapidly participate in up to 10 trials. This steady pace of presentation of the SD, Give Me Color, with various prompts will ensure that she will be able to independently identify colors in her environment after implementing DTT procedures. Including the learner in developing programs and allowing her to make choices when possible will help increase her learning. DTT uses DTT uses contrived contingencies to teach skills, unlike naturalistic teaching styles, where natural consequences act as both reinforcers or possible punishers. DTT requires the therapist, teacher, or parent to provide immediate reinforcement for correct responses, which can include praise, often paired with use of a token economy board. In this example, Lucy has chosen to work her reward of bubbles after earning 10 tokens. After mastering her colors in DTT format, her therapy team can work on generalizing names of colors across environments, stimuli, and individuals. This will maintain her skills and ensure that it can be used in the most functional and appropriate manner with intermittent reinforcement. Thank you.
Before you start your DTT session, be sure to have the appropriate stimuli that you will be teaching with. Since we will be doing a color identification trial, we will need color cards. Also, you will need reinforcers or rewards for the child. Andrea will be using a token board and reward Lucy with a token for every correct response she gives. Lucy can then trade in those tokens for something she enjoys, like time to play with bubbles. Remember, tokens alone are not very reinforcing. You should always have backup reinforcers for the child to trade their tokens for. You also want to have a pencil and data sheet, such as this one, that includes the learner's name, the desired response, location of the trials, a place to record the response as correct or incorrect, or non-response, or the types of prompts used to get the child to respond. It is helpful to have a menu of acronyms for the prompts that the therapist can quickly and easily refer to. Finally, a comment section helps communication between multiple therapists. Other materials that can be used in DTT include a stopwatch or a frequency counter, but we won't be needing those with Lucy's program. Here we will watch as Andrea runs a couple of color identification trials with Lucy. First, Andrea?
All right.
Okay.
What are we going to be working for today? Bubbles. Good choice. Okay. All right, Lucy, you've got 2 tokens.
All right.
You get 2 bubbles.
So first, Andrea presents the discriminative stimulus, or the instruction.
Give me yellow.
Andrea observes Lucy's response. Lucy responded incorrectly, so Andrea redelivers the instruction and helps Lucy by including a prompt.
Give me yellow. Thank you. Good job. Here's another token.
Andrea then observes Lucy's response and reinforces or rewards Lucy. During the intertrial interval, or the break between delivering reinforcement and the next instruction, Lucy accepts her token and Andrea can write down the level of prompting it took to get Lucy to respond correctly. Now let's see another trial.
Okay, Lucy, give me yellow. Good job. Here's your last token. Now we get bubbles. Good job.
Notice that because Lucy responded correctly on her own, Andrea gave her greater reinforcement. She was extra excited for her to respond correctly. If a learner does especially well or completes a difficult task on her own, it is important to reinforce more than usual because it was a better than usual response. Now Andrea will review data collection and how to determine whether or not her sessions with Lucy are successful.
So for DTT with learning the colors, we have a data sheet where we record up to 10 trials and the prompt level that's needed. So the data sheet that we have here for an example shows as the sessions progress from session 1 to 15, the prompt levels get less and less. So she goes from a physical prompt all the way to being completely independent at session 15. This is when we can decide if the task is mastered or not. So having the prompt levels recorded for each session helps us to determine if she's progressing. So obviously if we're using physical, then gestural, then verbal, then independent, she's obviously progressing towards her goal. Also, we'll look at a chart that's done with the percentage that this task is done independently. So if you look at this chart, the baseline is pretty low, especially for obviously the beginning. So as we increase her independence for the intervention level, we have an upward incline, which at the very end she's at 100%, which again then we would consider mastering this target out and moving on to another color.
Okay, and thank you, Andrea. And now Heather is going to talk to us about our school-wide implementation plan.
So for our school-wide implementation plan, we targeted typing. Typing has become one of the most important methods of communication nowadays. For example, nonverbal students can use typing to communicate with others, command and tact. To teach students how to type, a BCBA will first train the school staff on how to use DTT to target typing. Also, special education teachers can work with OTs and work on various skills that requires them to understand typing, such as manipulating their fingers and recognizing letters and numbers. Using DTT allows the educators to break down typing into smaller and more teachable components. The OT can work on typing with left hand and then right hand, and once the student meet the mastery criteria, then they could random rotate left hand and right hand that they could type more fluently. The parents will also participate and allow students to generalize the skills at home. It's important to present a variety of stimuli such as a tablet, a cell phone, and a computer so that the students can work on generalization. They'll also given constant guidance by the BCBA, who will offer both clinical training and emotional support to reinforce the parents' behavior of working with their kids at home.
And now some final tips for implementing DTT.
DTT sessions tend to evoke escape maintain behavior because it is repetitive and rigid. There usually are a certain amount of trials before the child is able to gain attention to reinforcers. Therefore, it's very important to increase the child's motivation before presenting DSD. Running a simple preference assessment to ask the child what he or she wants to play is very helpful, and it is also important to clearly set the contingency so the child understands how to earn the reinforcer. For example, you could tell Lucy that if she earns 3 tokens, she will be able to play with bubbles. That way she has the reminder of what she needs to do in order to achieve the goal. Also in DTT session, the therapists they ask a lot of questions in rapid manner in order to gain the child attention. It helps to limit the environmental distraction. Simple antecedent manipulation such as clearing the child's desk before presenting 2D stimuli can decrease the likelihood of problem behaviors. DTT focuses on skill requisition, then generalization or maintenance. Exposing the child to various stimuli to practice skills in vivo will help the child retain information more effectively. Thank you.
And that concludes our TED Talk. Thanks for watching.